No, afternoon. All right, so I am just getting ready for us to go live on YouTube and record this. All right, afternoon. Here we go. And we had some weird background noise. All right. Okay, so while I am getting this stuff rocking and rolling for everybody, I'm going to go over a few little things. So we are going to be engaging with y'all. So there's going to be some times where we want to have some conversation. So we have some polls as well as some places where we're going to be just letting you guys unmute yourselves and talking through some of the things we're going to be talking about today. Also, this call is being recorded. Everybody will receive a copy of the deck as well as the recording after the webinar today. If you have any questions after the call, you can feel free to reach out to either Cheryl or myself. Our contact information is right here on the screen. With that being said, we are going to go ahead and get started. All right, so this month's webinar is on making the business case for compliance. And I'm actually really excited about this topic. We've been doing some research around this and actually hearing from compliance officers who had a lot to say about where their current compliance programs stand. So some of the scarier things that we've seen is compliance officers that don't worry about compliance until they're told to worry about compliance because they're wearing too many hats, or compliance officers that feel like leadership doesn't understand exactly how bad their compliance situation is, and feeling like something is going to fail at some point or another. So what we're seeing is that compliance officers are overwhelmed, right? But leadership, if you ask leadership, how's their compliance going? They're going to say their compliance is right on track. It's going exactly the way that they think that it should be going. But this is the track that we're on, right? So it's a little cattywampus and it's not going to exactly get that compliance train to the point it needs to be safely. Right? And compliance officers recognize that this is the compliance track that they're trying to run down. Unfortunately, leadership thinks everything's a-okay. So I'm having some technical difficulties. Here we go. All right, so here's what the compliance officers were telling us. So we surveyed several hundred compliance officers across the country, and 72% of them complained that compliance seemed disjointed and that it was a very manual compliance management process that they were struggling to keep up with. When we dug in further and we asked those folks, why? Why are you experiencing so many problems? 38% of those folks said leadership is complacent in compliance. Now, Lane, I personally don't believe that leadership means to be complacent in compliance, which means they're not really complacent. It's just difficult to understand how compliance fits into the broader business of a hospital or a clinic or an LTC, SNF healthcare organization, right? And so when they're trying to struggle with that, it can appear as if they're being complacent when it's they need compliance to help them understand that. So that's creating a top-down push for compliance, which can be extremely overwhelming. Then we had another 30% of folks tell us that they had spreadsheet and binder fatigue. So simply put, keeping up with all of the different compliance regulations, as well as all of their implementation efforts and all the things that they have to track was exhausting. Excel was not exactly meant to manage compliance, and they're really feeling that. Then 22% of folks feel like they're wearing too many hats. So large health systems are lucky that they have a compliance officer. But when you're talking to critical access hospitals and smaller community-based hospitals, compliance is really relegated into departments like HIM, IT, revenue. It's in so many different departments, and those folks are wearing too many hats to be able to do anything really effectively. And then 10% of folks said that they had a lack of continuing education. And when we dug a little bit deeper on that, one of the biggest reasons why they had this lack of education was leadership wouldn't pay for them to go to these conferences like HCCA or AHIMA because of the cost. And with compliance being seen as a cost center, that makes things a little bit difficult. All right. So one of the biggest barriers we have to compliance is just simply the way that the rest of the organization views compliance, right? They see it as being in the way. Clinicians think that compliance gets in the way of quality patient care. Administrators think that compliance is important, but they don't know exactly the role that it fits into the broader business perspective or business objectives of the hospital or clinic, right? So one of the things that I always like to say is that compliance is the vascular system of the hospital or the clinic. It touches every department, everything that we do, and everybody is a stakeholder, right? And administrators don't quite grasp that. And then finance thinks of compliance as simply a cost center. They do not understand the role that compliance can play as a business protector and patient care protector. Then we have our IT folks. IT is really concerned over our cybersecurity, and they think of cybersecurity as a technical implementation versus cybersecurity and compliance going hand in hand. Because a lot of what we see with the breaches that are happening is because we're not training people appropriately, we're not updating our policies and so forth. And so when IT looks at it, they're like, oh yeah, we've got it because cybersecurity is good. So if you remember our track that the leadership thinks our compliance is on, IT thinks we're on track too, but they don't see how our track really looks. And then IT also thinks that the only real compliance thing that matters to them is the audits or the security risk analyses, but they also don't really see those as being able to move the needle forward, because a lot of times they're seeing the same risks year over year over year without a plan, a risk management plan in place in order to be able to correct and mitigate those issues, right? So and the risk management process is actually a compliance process. So on top of being the killers of joy and progress, compliance officers are often seen as a department of discipline. Many of your staff don't hear from compliance apart from your annual training programs unless there is a problem. And this relegates compliance into a very difficult role. Compliance is more than just being a compliance cop. When organizations create compliance as a scary thing, they will never achieve their goals. Compliance being seen as the rule enforcement or the punitive force or these compliance cops just simply does not work. Employees will be less likely to interact with compliance in a proactive manner, which can leave gaping holes that go unmitigated in your compliance program.
Yeah, Sarah, this is Cheryl, and I have to say that is exactly true. I worked in FQHC for 6 years, and we had 3 different compliance officers in those 6 years. I would hear complaints from the compliance officers that they always had to be the bad cop all the time.
Yes.
And they were never loved by the clinicians because the clinicians thought that they were always trying to create more work for them and add, this is quote, more clicks into their workflow. And administration understood the importance of the compliance, but usually they didn't think about it until after the strategy was already thought about and they had that going, instead of including compliance into their strategic initiatives. So those are a couple of things. And then of course, finance was always like, oh, you're coming back to us for more money. This should have been built into the annual budget, but nobody wanted to let compliance have any budget. And
Right.
like you said earlier, they were just citing it as that's just a cost center. It doesn't generate any revenue, you know, and with an average tenure of at least our compliance officers only being 2 years, it was really hard to keep compliance in the forefront. You know, and it really is, like you said, it's the vascular system. It's woven into every single department, even if it's not always visible.
You're so right, Cheryl. I mean, and that turnover is a big problem, right? So not just at the FQHC that you were in, but I mean, I saw it at the critical access hospital I was in. I saw it at some of the clinics that I worked at. I mean, it really is very difficult to retain quality compliance talent. And a lot of it comes down to job satisfaction and compliance officers. I mean, nobody wants to be the bad guy all the time, right? And so when we're leaving compliance in this role of being the bad cop, not only is it leaving us vulnerable, right, from a compliance perspective, but it's also costing us money because it costs money to train and hire a new
Yes,
person.
exactly.
All right. So, and all of this is actually leaving compliance team to push these boulders up cliffs. They are struggling to understand where compliance fits into the bigger picture of their organization. They know what they're doing is important, and as Cheryl has stated, so does leadership, but they are left without the necessary tools to do their job efficiently. So compliance teams are often segmented from the rest of the team and are given that role of rule enforcement, right? So you'll have your HIM responsible for privacy, you'll have IT responsible for security, you'll have somebody in your billing or revenue office in charge of coding, you'll have a CNO in charge of some clinical compliance, and it's all segmented without a way for them to properly communicate and work well together. And they create their own little strategies, which can create conflicting policies, which again creates even more of an angle for them to have to push this boulder up. And the biggest tool that compliance departments need is a seat at that strategy table. Compliance touches every single department, every single objective, and yet they are often an afterthought. Seen as a cost center and a burden, and they also lack the necessary support and tools they need to efficiently protect the organization. This cost center view means there is simply no budget for compliance. All right, so now we are going to launch our very first poll, which is, what do you think your compliance officer would say is their biggest barrier to achieving compliance? Or if you are the compliance officer, what is your barrier? So if you were asked these 4 questions, what would you say? So I'm going to let this go for just another few seconds. And it's really looking like, so I'm going to go ahead and end the poll. And we have 50% of people saying that leadership, like compliance, communication, or feeling of complacency. So it's that leadership complacency complaint. Sorry, my dogs are walking in. I forgot to close my office door. 14% have spreadsheet fatigue. 43% say that they're wearing too many hats or spread too thin. 29% say lack of continuing education. So it's pretty, I mean, obvious that leadership complacency and wearing too many hats is part of the overall problem with managing compliance. And we can actually see that because compliance is siloed. Healthcare is one of the most regulated industries in the country. So why do we silo our compliance teams and leave them all out on their lonesome to try to figure things out on their own? Continuing to operate in these silos leaves us at risk with our overall healthcare operations. Hefty fines from regulatory bodies such as CMS, the OCR, OIG, and all of that is troublesome enough. And we also have the threat of not meeting our deeming accreditation requirements, such as from the Joint Commission. And compliance officers are trying to balance all of those regulations as well as our accreditation. And it's overwhelming, to say the least. Compliance is often separated from your security and privacy operations as well. And security tends to take the lead and focus due to our current cybersecurity environment that we find ourselves in. And despite the increased exposure to cyber threats and increased regulatory activity, compliance is not aligned with the overall healthcare business strategy. Compliance is left out of key communications, and therefore the business justification for a robust compliance program is never integrated into the broader business objectives. Compliance officers find themselves fighting for limited resources, and compliance is often seen as this cost center versus a business and clinic protector. And this is because of this siloing that we see of compliance. So it's time for us to rethink how we are looking at compliance. Compliance should be a living program. It should be more than just a book of policies, and those policies should be more than just recitations of regulations. Because we have to remember that compliance is a journey, a never-ending journey. And treating compliance as a series of check boxes is not a roadmap for that journey. Having a compliance strategy and a goal to identify, mitigate, and eliminate risk, it should be the goal of your overall compliance program. Your compliance program should fit within your culture and needs of your organization. So most of our regulations are created in a way that are flexible enough to fit organizations of all sizes and types, which is important. Your compliance program should also promote growth, align with your future and current business strategies, build relationships throughout the organizations through strong communication channels, and be revised when they no longer work for the goal. Compliance is a dynamic thing. It is not static. It cannot stay the same. You can actually outgrow a policy, or you can adopt a policy that is too intense and you need to let some of it go. And then we also have changing regulatory requirements that we need to think about as well. So we need to be able to continually to revise our compliance program as we are adopting new business objectives, as we grow our hospital or our clinic, and as regulatory environments change. So when we start to think of compliance as a risk management activity versus a following the rules activity, it becomes really easy to see how compliance fits into the overall business objectives of your organization. Compliance is more than HIPAA. It covers all of your regulations, CMS, OSHA, PCI, the ONC now with information blocking, your accreditation, the list just goes on and on because we are such a regulated industry. And when we start to think about how we can actually manage all these risks while supporting following the rules and growing our business, that is where success is found. We know that healthcare operations is really complicated, but a lot of healthcare organizations are left without a compliance operations business line, right? They're left to kind of figure things out on their own. We often work on these slim margins with limited resources. We all have the ultimate goal of delivering the highest level of clinical care to the communities that we serve. Oftentimes we operate in silos, competing for these limited resources. However, leaving compliance all by their lonesome or not including them into the business strategies can cause big problems. And we're not just talking being out of compliance. Non-compliance has consequences, again, those fines and penalties that we want to avoid like the plague. Maybe it's too soon after COVID for us to say that joke, but whatever. But it's also having to rework your strategies. If you come up with an objective and you put together your goal, your strategy, your tactics, and you start to actually implement it, and then you involve compliance, you can actually have to rework stuff, which is going to cost you a lot of money. So when new strategies start to trickle down to compliance, you're going to face these obstacles, which is why we went over how most departments feel about compliance. Like we tend to be the department of no, you can't do that versus the department of knowledge in sharing our expertise in order to be able to promote growth. So when we start to align compliance with our financial and clinical operations, that is where we find success. Success in achieving our business growth, success in achieving the best possible clinical outcomes, success in monitoring and protecting your security and your privacy. All of this is found when you can start to align all of your operations and you find that nice overlap piece. So essentially, compliance needs to be seen as an important partner with your other hospital operations. Compliance, when executed properly, and when included in your overall strategies, is a vital business tool. Viewing compliance as a department which impedes growth or sucks resources from other objectives and departments will hold you back from achieving your goals. All right, so now we're going to launch another poll. And oops.
Yeah. And Sarah, I have a short story kind of to go along with what you were saying, because it's true. If you're not including compliance in your strategic planning, so it is kind of like what you said earlier, the vascular system, and it's included in everything, your project management can become like a total nightmare. My story is that I had just started working for an FQHC many, many years ago, and I was their dental clinic manager. And about 2 months after I started, I heard some of the executive team talking, and they had decided they were going to apply for a grant that would fund a new dental EHR that was going to affect me. I was over the moon happy. And it was also going to fund a new business operation in the medical department. They were going to start doing X-ray, and they had about $70,000 in this grant that they were going to spend on X-ray equipment. So guess what? They ended up getting the grant. Of course, I was thrilled. I didn't really, at that point, I didn't oversee the medical clinic, so that part didn't apply to me. But my department got their money and ended up getting their new EHR. But the medical department ended up with a really big mess on their hands. They ordered the X-ray equipment, all 70,000. Actually, I think it was a little bit more than that. And they got it to the basement of the building that we were housed in. And unfortunately, our compliance officer had left in the middle of this project. And when the new one came on, she had a whole bunch of questions, and she started doing some digging and discovered that because our building was so old, they had said if we had any structural changes made to it, they would not be grandfathered in. Like, we had to actually change the elevator. And the only way to get to the basement to this new X-ray equipment was through an elevator that was non-compliant. And so our new elevator bid came in at just over $600,000 for a $70,000 X-ray project. And so it was really sad. It was really unfortunate. We could not afford it. The decision was made to pay back the $70,000 to the grantors, and we, the ones that were going to fund the X-ray, and we gave them back the money. And unfortunately, when I left the health center, the X-ray equipment was still sitting in the basement after 6 years. It was very, very sad. But that's exactly what you were talking about. Compliance really does need to be involved in strategy and in every part. It's just in every part of your organization.
Thanks for sharing, Cheryl. Especially since that was a HRSA loan, or HRSA grant because an FQHC, that becomes even more complicated.
It was very complicated and probably involved a lot of money in legal fees too, unfortunately, on top of everything else. So it was really, really sad.
Okay, so we launched a poll. It looks like the majority of you guys have voted, but if you haven't voted, now is the time. Do you include compliance in your strategy sessions? Or if you are the compliance officer, are you included in those strategy sessions? So here I go. I'm going to go ahead and end the poll in 3, 2, 1. And we'll share the results. So it looks like more than half of folks are included in strategy sessions, which is awesome. Congratulations. 18% sometimes, 18% no, and 12% didn't realize that compliance needed a seat at the table. So all of that is, here we go, exactly why you cannot create an effective strategic compliance program without integrating compliance with those business strategies. Business objectives tend to be siloed. And silos don't work when communicating. Oh my good night. I'm so sorry. Here we go, y'all. The joys of doing a webinar from home when the mailman comes. I am so sorry. As soon as the mailman leaves, Oliver will stop barking. All right, so business objectives tend to be siloed, and silos don't work when communicating compliance. A maturing compliance program will quickly outgrow a silo. An overall lack of trust in compliance is the biggest risk to your organization's compliance objectives. Right? So this is one of the biggest reasons why compliance needs to be involved in the entire process of creating and overseeing these business strategies. So if you are new to the strategy game, which about half of y'all are, or the business objective game, this is kind of how hospitals break down their objectives. They're broken into goals, which are specific and measurable, your strategies, which is like your plan of attack, and your tactics, which is the nitty gritty of how we're going to actually start to implement these new objectives. So now we're going to go over an example of what one looks like. This is actually an objective from a hospital that we've worked with. So their objective was to increase new revenue growth. They're going to do this by increasing their net margin by 20% in the next fiscal year. And the strategy was to improve patient experience and to inspire more patient referrals while reducing employee turnover and increasing their receivable collections. So these were the tactics that they outlined. So here's where we want to actually start to engage in chat with y'all, because I'm going to ask a couple questions. So if you guys want to, you can just unmute yourself, or you can submit it in the chat and we can talk. All right, so if your hospital had this objective and these were the tactics that they wanted to actually implement to achieve that objective, which by the way, y'all, this is a very common objective for a hospital to have. So what would be some of the red flags with these particular tactics? And if there aren't any red flags, so to speak, with the way that things are written here, what are some things that would require compliance attention? So don't be shy, chat up. Oh, come on, y'all. Nobody sees anything?
I think they're just shy.
I know. All right. So I can see some, right? So if we're, okay, so somebody wants us to rephrase the question. All right. So these are the objectives that the hospital wants to do. And this is how they're going to do it, right? So they're going to be increasing their marketing by following up with patients after discharge. They're going to follow up after missed appointment to try to recover those appointments. They're going to be doing patient education on new programs that the hospital is introducing, and they're going to inform the community of new technology advancements. So when we look at just that increase in marketing, if we put on our compliance caps, is there anything that we can see here that would raise a red flag or at least need compliance involvement in while we're going through these tactics to achieve our 20% growth objective? All right, so somebody's saying those incentive programs is a potential red flag. And the follow-ups too, right? Because we're thinking about this from a HIPAA perspective for the follow-ups, the staff incentive programs, there can be a lot of issues with that one that compliance needs to be involved in, right? Even when we're talking about the community outreach, there's some things that need to be there. Missed appointments is another one, right? Because if we're working with it with marketing, we have to make sure that we're following the privacy rule. All right. So when we start to try to build a business case, there are several steps that we need to do, right? So if we were going to be sitting at the strategy table with these objectives, and we're going there and we're starting to see this, right? And we're saying, okay, well, these physician incentive programs that we want to implement to increase new referrals, right? So we need to start thinking about what is the potential impact or the potential risk to our hospital or our clinic if we implement that as it stands, right? So we start thinking about what some of the potential impact could be. Are we going to get into maybe some potential stark issues? Is there going to be like any other issue that we need to start to do? And we need to actually map out what those potential impacts would be. So if you are the compliance officer, this is what you should be doing at the strategy table. If you are a leader of a hospital, this is exactly why you need your compliance officer at the seat with you to be able to tell you what these potential impacts and that risk is. Your compliance team will also be able to help to identify these risk and compliance knowledge gaps. So this is a gap that did not exist before you wanted to implement this goal, but it will exist if you go ahead and implement it, right? So maybe these incentive programs, your compliance officer isn't up to date on what all of those regulations state, but they know that there's an issue there. They need to be able to come and tell you, hey, this falls outside of what I'm aware of. Here's what we need to do. Here's where we need to go in order to fill this gap. And then you need to do an internal needs analysis, so that you can accurately capture all of the risk of implementing this incentive program, right? You need to be able to quantify the potential losses. So numbers are better when we're talking to leadership, better than the quality and like analytics with this internal needs. They'll understand if we implement this, we could receive a fine up to $1 million, or we could have to reimburse CMS for all of this money that we just billed for. Those are things that they'll understand. They won't understand, like it's more difficult for them to get behind you if you're using qualitative data. The next thing we need to do, so when we're thinking about this incentive program, is we need to paint the picture, right? When we're talking to leadership, or leadership needs for compliance to build this picture for them as well, right? So there are two pictures we need to paint. One is this perfect scenario, if everything goes exactly right. And the next picture we have to paint is the worst case scenario, right? And then with both of these scenarios, we need to understand, like, what do we need? Do we need soft dollars, meaning time and existing resources, in order to support this goal? Or do we need a budget line item that's going to require to be built into the budget in order to achieve that objective? Then we also need to come up with anticipated outcomes. If we do it this way as it's written, here's what might happen if we do X, Y, Z. Right? And you need to be able to really spell all of that out. And as leadership, this is what you should expect from your compliance officers. They should be able to do this for you because they understand the regulations and the culture and fit inside of your organization better than anybody else at that strategy table. And as we're moving through this, so after we paint that picture and we create those anticipated outcomes, we need to create a recommendation, right? And again, this is all the stuff that your compliance officer should be doing for you, right? So when we're working on creating that recommendation, it's here based off of everything that we've done, from the needs analysis to how it can impact us and what do I need. You need to be able to say, okay, this is what I recommend we do in order for us to be able to implement this tactic. And then you need to be able to justify your recommendation, right? You need to be able to say, this is why we need to do it. So don't just like write down what needs to be done. You need to say, and why. And then you need to conduct a cost needs analysis. And this is where being collaborative with other departments and removing compliance out of those silos is actually really beneficial, because you can work with the revenue department or the CFO to help you to figure out this cost needs analysis. All right, so after all of this, I'm going to go ahead and tell you how HIPAA can actually help you through all of this, right? So one of the biggest problems that we have when we're managing compliance is, wearing too many hats, spreadsheet binder overload, and feeling like leadership doesn't care about what we're doing, right? And a lot of that can come down to time management, and where we can save time on the day-to-day tasks so that you have more time to spend on strategy. And we do this by easing the access to all of your policies, automating your processes, such as sending out security reminders, sending out your training, doing a self-assessment, and all of that will help you to have complete oversight for the whole entire compliance process, as well as up to leadership as you're implementing these strategies. Here we go. All right, so at HIPAA, we have over 75 years of combined healthcare operations and compliance management experience. You heard from Cheryl Stevens, who is our Director of Client Success, talking about the experience that she had at her FQHC. Every single one of us here at HIPAA have experience in healthcare administration. So we have sat in your shoes. We know exactly how you feel. We also know that automating your compliance processes through a compliance platform like HIPAA can save you time and money. So this is an ROI for a critical access hospital where you can save significant amount of time that you're spending just doing the nitty-gritty of managing your compliance. And you can save up to $15,000 by automating your entire compliance process. So all of your policies, all of your tasks and training directly through a compliance platform like us. All right, so I have our last poll for the day, and that is launch poll. Would you like to hear more about how we can help? And while y'all are answering that poll, I am going to open it up and take questions. So feel free to chat or unmute yourself. We would love to hear from you. Cheryl, do you have anything else to add while we're waiting for folks?
Well, I was just thinking, because I do the majority now of the training with the new clients and everything, there's been so many times that I've said to clients as we're going through the training, gosh, I wish I had had a platform like this when I worked at the FQHC, because there are so many times that I remember trying to find a policy on our shared drive, or did I know if it was finalized or not? I mean, some of them were finalized, but they were never signed. And so HIPAA really eliminates some of that for you, because you finalize the policy and then that's what your staff can see. That's the final policy. Same thing with keeping track of your business associate agreements. I thought to myself, oh, it would have been so nice to have them in one spot and be able to organize them and sort through them. There's just so many times that I think, oh, I wish we had this when I was at the FQHC. We didn't have anything. When you talked about binder fatigue before, I thought, I was not the compliance officer, but I worked very closely with her, and we were both just absolutely exhausted, especially when HRSA would come in and do their federal site visit, their on-site visit every 3 years. It's a lot of prep. And this program would have made life so much easier.
No, well, I mean, that's the whole reason why HIPAA was even founded, right? That's the founding story. Was I was overwhelmed with trying to keep up with everything in the nephrology clinic that I managed, and I was so tired of it. I was like, there has to be an easier way. And I started looking and I just saw like what I thought of was Dropbox for HIPAA. And I was like, there has to be automation. And
Yeah.
so that's when I founded HIPAA, right? Because like it does need to be more than what I can do on my own with a shared drive, right? It has to be something that can actually help influence how I'm making decisions and how we're actually creating our strategies and moving things forward, right? So the worst thing in the world is to feel like your compliance program is even a weight around your compliance officer's neck. And so having a platform just makes it so much easier to do all of that. So I would like to take the time to thank everybody for coming today. If you would like to reach out to us, I know we didn't have Jane talking this month. I cannot wait to have her back next month on a webinar with us, but she will also be on our HIPAA huddle. You can reach out to our lovely Director of Sales, Jane Bro. There is her contact information. You have my contact information up there as well. And we hope to hear from y'all soon. And we hope to see you again on our next webinar. Thank y'all so much for coming today.
Thank you.